So let us start with the session with few questions which were asked on Instagram, but I could not finish it. That's why I'll do it now. And some questions on the WhatsApp on my mobile. So there were a lot of inquiries about regarding fear, how to prescribe on fear and how to prescribe on which fear, and there are basic fears of life which most of the patient tells us and whether to prescribe or not. Now see, if you are prescribing only on one symptom, and if you feel that that symptom is defining the whole personality, the whole case, then it's okay, you can prescribe. Otherwise, just prescribing or just taking one symptom for prescription, like Dr. Moria, like we have fear of lizards, fear of cockroaches. Uh, these are the basic fears of life. But if you prescribe on fear of lizards and fear of cockroaches, or you'll not be able to treat that case. That is my opinion. I have treated lots of cases of fear. No, normally we have fear that somebody is coming and what will happen to what will happen to my child, and what will happen to my family, and if I don't pass the exam, what will happen. These type of fears again basically are soric fears. No, if it goes out of control, if anything, if any fears goes out of control, then you can think about the remedies like that. Welcome Dr. Motwani. Now if you have like fear of rats or fear of reptiles or fear of scorpion, fear of frog, and fear of snake, and fear of dog, fear of flies, spiders, these fears basically I know that they're in the repertory, but normally I don't prescribe on those type of fears. If it is very out of control, then maybe I'll think of it. So I'll take a question first. That is very important. Mother tincture bataiye sir. Mother tincture for cough. See, there are a lot of mother tinctures for cough. If you have, I don't know, if you have seen my cough remedies on YouTube, there are 3 or 4 parts which I have told something in relation to cough, and most of the remedy I have covered regarding cough. Regarding mother tinctures, now I don't use so many mother tinctures for prescription, but maybe previously, if you want some mother tincture for prescription, the basic mother tincture that you must think about is first is Justicia. It is universal. You can prescribe Justicia basically for dry cough or wet cough or any cough where the patient has just started coughing. Like for instance, the patient comes to you just in the morning, the cough started, the patient comes to you in the evening or next day. So initial symptoms you can cover with Justicia Adha Thoda mother tincture. If you go further and the patient says there is a lot of rattling of mucus, cannot take it out, then you can think about Grandilia. You can think about Arelia racemosa. There is one mother tincture which you can use it very commonly, infection, not infection, very commonly. That is Eucalyptus mother tincture and Yerba Senta. Go home and read Yerba Senta. It's a very interesting mother tincture. And for dry cough, we have classical remedies: Drosera, Spongia, Mephitis, and Corallium. So these are the mother tinctures you must think about. Do read something about Yerba Senta, Eucalyptus. These are the mother tinctures. If you don't understand and you find that your remedy is not working, or you feel that you require some aid or some support with mother tinctures because you feel that your prescription, you're not happy with the prescription, or you think that you are not confirmed that this is the remedy, then you can think about these mother tinctures. Of course, this I have used in my practice. Urethral stricture in homeopathy. Yeah, urethral strictures is definitely treatable in homeopathy. I have lots and lots of cases where I have treated and I have cured that. In fact, if my students who are working with me are seeing the live, they'll understand that there was a case taken by them only. We had prescribed the patient Brata Mure, and that patient is totally cured within 3 months of treatment. If they are seeing the case, there are cases where did not get satisfactory results with stricture, so the patient had to go for dilatation. I have cases where the patient has come to me after dilatation. He has to do dilatation once a week or twice a week. But after taking my homeopathic treatment, now the dilatation is maybe once a month or once in 45 days or 2 months. So this is as good as cured cases. So yes, definitely we have very interesting results with homeopathy in neural strictures. Just one advice, don't give the specific medicines like calcarea floor or theosanamine, these are, or clematis or rhododendron. These are basically, we call it specifics. I have do not get result with specific medicines. Regarding biochemical medicine, you can think of giving the patient Silicea 6x with your medicines, what you are giving a constitutional or an acute medicine. Silicea 6x and calcarea floor 12x potency works good, I feel, in cases of urethral stricture. Okay. Of course, if if you have a case where stricture is because of multiple partners and not using protection and all, then you can think of medorinum and other remedies which are also very interesting. I had a case of stricture because the patient suffered from recurrent urinary tract infection and the patient had taken a lot of antibiotics. So antibiotics relieved the symptom, but he again get the strictures. That patient recovered beautifully, totally cured with Cantharis LM potency. I started 0 by 7, then 0 by 8, 0 by 9. So we reached Cantharis 0 by 12 and the patient is totally cured with that remedy. So it depends upon what is the cause of stricture, what is the age of the patient, and then you can think about repetition and potency. Don't go for specifics because I have not got result with specific medicines. I hope this answer is okay, Dr. Sagar, I think. Little strictures, cold cough. Dr. Bipin, I hope it's the question is answered. Dr. Moria, yeah. Sir, your experience of cancer cases, please. What presentation other than with simillimum and chances of cure in your experience? Yeah, Dr. Moria, very interesting questions. And today in this psychosyphilitic world, we have every day the cases of cancer are increasing. And again, if I would refer to my doctors who are working with me, we have good number of cases to show that homeopathy works in cancer. If the patient comes directly, which is very, very difficult, if the patient comes directly to you and he asks, sir, whether the cancer is curable, so you can't tell of course, I don't tell the patient, yeah, guaranteed theek ho jayenge, it is curable. No, we say that we'll try and we have got the medicine. So that's a risk. If the patient comes to you and the cancer increases, and then the patient goes to the allopathic doctor and the doctor says, you have come late, why did you give homeopathy? And the patient says, oh my God, I did a mistake. So we have cases where the patient comes to us in spite of allopathic treatment, other treatment, he's not recovering, we have good results. Also the patient comes to us where the patient comes to say that I've operated, but the doctor says it can reoccur, then we can prescribe some medicine so that there's no recurrence. I have many of cases where the patient operated has come to me for follow-up where he wants that the cancer should not reoccur, and he is with me for the past 5-6 years and no cancer has relapsed. This is one part of your answer. Second part, what to give? Yeah, this is an interesting question because I also have cases where I give the constitutional medicine, but in between, for example, if there is ulceration, if there is pain, I do give some medicines. Like if you have heard my cancer lecture, I have told you that I have treated those cases where I have used in between for basically. Sorry, there's a question on WhatsApp. So yeah, there's a question, same thing. So if there is ulceration, I used to give acute medicine like anthraxinum. I used to give medicines like for acute I used to give myristica or sometimes arsenic also, depending on symptom. I had a case where the patient had morphine patches because of the cancer pain. Still the pain was not better. In that case, I used Echinacea angustifolia, wonderful results, carboanimalis, carbon sulf. So I also give some acute medicine sometimes. It's an open wound, what happens, there's a lot of pain, there's a lot of ulceration, discharges pus. In that case, I sometimes give the patient calendula mother tincture external to clean the wound with that. And if there is ulcerations, if there is decubitus, if there is, so I give the patient along with calendula Echinacea mother tincture also to clean up the wound. So it depends upon the case to case, but the answer is yes. I also use some other medicines in acute conditions where I have got very good results in cancer. In short span, I hope you understood what I want to tell you. Hello, Dr. Bharat. Sir, I'm new student homeopathy. Yeah, new student homeopathy, you are very lucky because in today's world, there are so many apps, programs, cases available on social media where you can gain confidence. 30 years back, when we used to study homeopathy, we hardly had cases, hardly had any material to study. We study from books and repetize the case on the big sheets, putting the markings, and also you're lucky. And we do expect that you become better homeopaths than us at an early age. We took a lot of time to get to this position. Okay. Dr. Mahesh here on the side, Delta COVID hospitalized patient with hypothyroid and Crohn's. Can COVID was the cause? These autoimmune disorders patient believe for cure in homeopathy. Yeah, why not? Why not? I had cases where the patient after COVID suffered from, the whole lungs was fibrosed, and the patient was on oxygen cylinder. With homeopathy medicines, we were able to not treat the patient, also cured the patient with the whole fibrosis totally cured on the report also. I had cases with the patient because of COVID and all suffered from high cholesterol, dyslipidemia, totally treated and cured with homeopathy medicines. If you feel that the cause is classically COVID and your medicine not working, do give the COVID-19 no sword, which I have made. I given a lot of cases with good results. In fact, COVID-19 no sword I use also today for cough, cold, coryza. Also, it has got beautiful results. Okay. Aching pain in the scapula, my dear friend, there are so many remedies for that aching pain in scapula. You can think of simple, remedies like Macphos. You can think about Rustox. You can think about Chilodonium. Lot of remedies are there. Depends on what is the area, why is the pain. It's fibromyalgia, it's neuralgia, it's muscular pain, it is secondary to diabetes. There are a lot of things you have to think in prescribing the remedy. So kindly some medicines for bed sore and pain and pus. I told you, remedy for bed sore I use sometimes calendula to clean up the wound, sometimes Ischnia to clean the wounds. Sometimes it is painful, it is burning, then anthraxinum, then arsenic. Of course, give the constitutional medicine also, so that the tendency to decubitis also is taken care of. Heal pain worse by walking, standing, ascending stairs, by ice water application, rest. You can think of remedies which are chilly, better by heat, bryonia, arenia, ruta, lot of remedies. Graph note of Vishaka. So kindly some medicines for bed sores. I have told you some medicines. Okay. So these heal pain. If I was to there's an interesting remedy called as heal pain in the heel of shopkeeper girls. The remedy is Squilla. And heel pain basically is a very irritating disease to treat for me also, because if you have a problem when you are standing, and if you're standing, the whole part, whole weight is on the heel, and it's very painful. So whenever the patient gets up after rest, automatically the heel pain starts. So it becomes sometimes difficult to treat, but it is not incurable. You can give in repetition. That means you have to give that in LM potency. Okay, so you can write some remedies which are very sometimes very rarely prescribed, but I have got results. Apart from the basic remedies, think about rhododendron, think about pulsatilla, think about kali iode, think about colocin, think about petroleum. Of course, match some symptoms and you can get the remedy. Okay, otherwise ruta, Belisper, Macphos, Arena Didana, Squilla, these are very common remedies for heel pain. Okay, thank you for your guidance. Thank you so much. Emergencies in trauma cases. I don't know what emergencies you want to know, but definitely there are cases where the patient, road accidents, patient goes in coma. In the hospital we go, we give medicine, and the patient comes out of trauma. All trauma cases are not arnica. Believe me, there are so many remedies where you have to see how did the trauma happen and what was the patient thinking at the time or before accident happens. This is also very important, my dear friend. I had a very interesting case when the patient, he was sitting back on the scooter, and when the accident happened, the front passenger got injured. He got fell down, he got fractured, he was okay, But the second passenger was so much worried. He came home, he started fainting, he had involuntary urination, he collapsed, body coldness of body, and he did not have anything. The poor guy, the other guy had a problem. I was called, and I was thinking of the case. I said maybe call the ambulance and we'll see what to do. I gave the dose of camphor to the patient, and within half an hour the patient was up and about. So the effects of trauma, how did the patient take that trauma? That is also very, very important. I hope Mahesh you understood. Maheshwar Verma, you understood something about trauma. Pain when patients goes downstairs only the initial time after. Yeah, this is a very, very this is a very, very common symptom in case of plantar fasciitis. Patient says that when I get up after long sitting, initially when I walk there is pain, and then I walk continuously there is no pain. And the patient said that when I wake up in the morning and I'm sleeping, then when I wake up, initial steps are painful, then I can walk easily. So this is a very, very common symptom. Please don't give Rustox every time. Otherwise, what will happen? Rustox will, this is a very common symptom of Rustox. I have hardly got any result with that. If it is very, very pronounced, then it's okay. Otherwise, you have lots of remedies. Take this as a very common symptom, and then you can prescribe other remedies also. Now, if you have heel pain and the patient says descending is, so this is not uncommon, my dear friend. This is also very common. Sometimes, patient has pain while descending also. So if you are not able to get the remedy, you can take a generalized rubric, aggravation descending or descending aggravate. Then you can think about gelsemium, ferrum metallicum, lycopodium, borax, ruta, stannum. These are the remedies, descending aggravates. Okay. Rustox doesn't work. Yeah. So this is because I have made a mistake years back. Every case, the patients to come and tell me, sir, when I sit and I start walking, initial part there is pain. I said, okay, that is Rustox. And it did not work only, And I felt why it is not working, why homeopathy is not working. Then I started getting symptoms. So either you can take a generalized symptom, a generalized, like Bonegosian concept, what is true to the part is true to the whole. Generalized descending aggravation, you can think of gelsemium, ruta, rhododendron, borax. And basic descending also, we have those symptoms. For example, if you go to the rubric, I think in generalities, localized, and then you can say there's a descending pain in there's pain in the knees while descending. Then we have sulfur, we have veratrum, pain in the patella on descending. I had a very interesting case, the patient classically told me, sir, there is a pain in my patella when I'm walking down your stairs also. I did not give that remedy because that remedy did not have the symptoms. But then I thought the remedy is not working what I have given. So I just went to that rubric, descending pain in patella. The only remedy is nitric acid. I gave the patient nitric acid, LM potency, and the patient is better now. So sometimes, local symptom, it is very, very three marking, then you please prescribe the remedy. For example, I had a case where the patient says that I have pain in the thighs, a lady, pain in the thighs on descending stairs. Very, very typical symptoms. In that also, I gave the remedy, did not work. Then I went to the repertory and saw the remedy, the only remedy for that, pain in the thigh on descending, the only remedy was Sabina. And Sabina treated and cured this case. And surprising, that lady told me, sir, in my menses also there was a problem, there was a lot of problem. And with your remedy of pain in the thighs, that menses problem is also getting cured. This is the beauty of homeopathy, Sometimes some vague symptoms, and we hit the remedy right, other symptoms also get cured. So in my initial day of practice, the patient used to come for pain, and the patient said, sir, because of this pain remedy, this symptom is also better. So this will happen in your case also, my dear friends. Sometimes I had a very interesting case when the patient told me that, sir, I have pain in the knees. I have pain in the knees when I walk down your stairs also. So I don't know which symptom I took and I gave the remedy Badiaga, which is there in the repertory. And the patient came to me after and said, sir, my knee pain is better, but I had got a problem of recurrent cough. The cough was so much rattling cough, which was not getting treated. And with your remedies, I don't have cough also. So Badiaga, basic remedy for cough, but Badiaga also has symptoms of pain in the knee on descending stairs. Are you with me? Everyone? Dr. Saab, did you understand? Yeah, hello Dr. Barber. So did you understand this descending pain, my dear friends? This is very, very important, a very, very interesting question asked, and this is important to know from which remedy to prescribe. Otherwise, you can know the mater medica, the soric symptom, the psychotic symptom, and the syphilitic symptom. You can get symptoms of the remedy, and your mater medica is very good. You know everything of the remedy, for example, arnica, the soric symptom, the psychotic, and the syphilitic. But when the patient is in front of you, you are not able to decide what to give and what not to give. Understood? So this is very important. Sometimes every time I would say the patient teaches us which remedy to give. So this is also, I had a very interesting case when the patient came and told me, sir, whenever I walk down your stairs, my clinic is on the first floor. So whenever I walk down your stairs, I have vertigo. He came for vertigo, so he had taken Vertin, and there was no result. So on repetization, I got the remedy ferrum metallicum. So I gave the patient ferrum metallicum. The patient did not come after a month; he came after 2 months, and the patient was so happy. Said, "Sir, my vertigo is better, but something very strange happened. My hemoglobin was never above 10 since 10 to 15 years. But what medicine I don't you give? My hemoglobin is now 13.2. We get the report also. So ferrum metallicum given for vertigo also worked for the low hemoglobin, which I did not ask the patient. So knowing mater medica, very good. You can know mater medica page to page, word to word. I also teach my doctors who are with me. But when application comes, the mind becomes blank. Are you with me? Am I right or wrong? Everyone. Simple question to everyone. Your mater medica may be very good. So learning mater medica from the patient, if he is cured with some disease and then I teach you mater medica, is more important rather than mugging about the symptoms in mater medica and then having satisfaction. I know the remedy so well, but what is the use? You must know remedies because I gave the remedy X on that symptom, and now I am teaching you that remedy from that cured case will carry more weightage rather than you learning the mater medica from Allen Skinner, Boger, Nash, Kent, Clark. Are you with me? So everything boils down to your assessment and interpretation of the case which is sitting in front of you. Otherwise, aggravation first motion in most of the case of arthritis, osteoarthritis, rheumatoid arthritis, calcaneum spur, plantar fasciitis, no result. And you say, I know Rustox, the soric symptom also, the psychotic symptom also, the syphilitic symptom also, very nice. But where will you prescribe? Because you don't know what to prescribe, what to see in that case. So, whatever doctor you join, whatever doctor you learn from treated and cured case. Rather than hearing beautiful mater medica, different ways of explaining different symptoms and rubrics, you will be a good doctor who knows good knowledge about all the repertory and mater medica, but no application. I was the same 20 years back. I knew repertory, the mater medica page to page, line to line. But when it came to application, patient in front of me, no results. So this is how I learnt my mater medica. So I want everyone to learn from your mistakes, from your cured cases, from your treated cases. Go home and write down which symptom you took for prescription. Forget it is there in the remedy or not. After 10 years, when you write down, you develop your own mater medica. That is clinical mater medica. Clinical mater medica. What you have seen, no? There's no need to make people understand that this is right, this is wrong. It is for you to understand. I have seen in my practice these symptoms are getting cured. That's the, that is the gold mine which you carry. That's experience. So the experience of treating patient is more important than the experience of learning mater medica or hearing good lectures from good doctors, but no practice. So this happens to you, Dr. Moria, this happens to me also, and this will happen to everyone. but it is important to, first of all appreciate, yeah, this is a problem. If there's a problem, then you have to think about the answer. Otherwise, ferrum mate you give to any case of anemia, it does not work. But because that patient was suffering from vertigo, I gave the remedy, and after 2 months the hemoglobin, which was never above 10, was 13.2. Are you with me? Are you understanding? This is the basis which we, here, which I have seen in my practice. Are you with me, everyone? Exactly this happens when common symptoms of a medicine don't work. Many new doctors are confused at the first case. Yeah, see what Hahnemann has told, rule out the basic symptoms of the disease and then see the symptoms. It is very good. But sometimes that is also not possible. That is also not possible in case taking. There are so many rare symptoms of a disease where it is written somewhere and you say, oh, this is a symptom, I should not have prescribed. Yeah, unprejudiced observer is basically the aphorism which I used to treat from day one from my college days. Very easy to understand but very difficult to practice. But make a habit of practicing that. If you make a habit, your practice will grow gradually. It will not grow suddenly. It's a marathon. I am the example. It went gradually, but now I am enjoying the fruits of my practice, the clinical experience. Every time I tell to my doctors who are working with me, please see the result. Please see the result from your own eyes. You have taken the case, we have prescribed, and that's the results. That's the beauty of homeopathy. So let us go forward. Medicine concept is clear, yes. A patient with high triglyceride, blood pressure 160, 110, with high uric acid, dyspnea when walking and left arm tingling, may Sumbul will be, no, Sumbul will not work. Sumbul will not work. The patient has high TG, high BP, high uric acid and dyspnea. So Sumbul is basically a very acute medicine. If you see the Matermedica of Sumbul, if you open, see, basically I use Boric Matermedica for this remedy. So please open Boric Matermedica and see Sumbul. So if you want to add Sumbul to your constitutional medicine, then you can think about Sumbul. But there are, better medicine apart from Sumbul also. Are you with me? There are better medicine apart from Sumbul also which you can think about. If you have Sumbul, Sumbul is basically a remedy for heart disease, which I have told you, but Sumbul has nervous palpitation. Your patient is already having blood pressure. So blood pressure, what is the pressure in the patient's life which is increasing the blood pressure? That is the distal part of the artery. So what is that pressure? First understand the pressure situation of the patient because of which the blood pressure is rising. That is you have to hit in the case. Of course, the Sumbul patient has the symptom of nervous palpitation. He has the symptom of loss of breath on exertion. He has the symptom of heaviness of the left arm. But these are the very common symptoms of arteriosclerosis. And if you read Sumbul, I don't know the name of the doctor, but he has told us to prescribe Sumbul 2x potency every 3 hourly. But in your case, treat the blood pressure, treat the pressure. What is the pressure the patient is going through, the person is going through, and then give the remedy. Okay, I hope you understood, Dr. Saab. Sumbul would work as an acute medicine, 2x potency. What is there in the Matermedica, Boric Matermedica? Are you with me? If also read Lactodactylus mecanthus, same symptoms of angina pectoris, Lactodactylus mecanthus would work. Okay, are you with me, sir? How and do check the patients in this type of patients the sugar also, because if the TG, the triglycerides, is high, the patient also might be suffering from either pre-diabetes or diabetic condition also. Okay, so there are certain typical symptoms of some specific medicines. So for specific medicines, you have to know the Matermedica very well. Okay, are you with me? Did you understand? Matermedica is basically if you see Sumbul, there is a very interesting symptom, if I am not wrong, in Sumbul: oily pellicle on the surface of urine. Oily pellicle on the surface of urine. See, when there are rains and the whole road is wet, and suppose some vehicle goes and the oil is leaking, how you see the oil and the water, that is the urine of Sumbul. And you also read the urine of Aster Rubens. These are very very typical symptoms of the remedy. Okay, so do understand matter medica through clinical point of view. Today's takeaway point. Okay, so thank you friends, thank you for joining, and I hope you enjoyed as much as I enjoy sharing knowledge with you. Thank you so much. For next Thursday, prepare questions also. Okay, bye.